over there with some donations and money. And then we also talking to a couple of different places around anticipating very large influx of Ukrainian and Russian refugees, including our area, trying to decide how we can handle it. So if anybody is interested, please do reach out to me. We will be developing some form of trauma resolution, potentially with Center for Mind-Body Medicine, probably with GW. We don't know yet. So there's going to be an attempt at trying to figure out what we can do as local community. But anyway, I just wanted to mention that. I don't have a lot of updates, as one of my friends put, what are the numbers of COVID patients? And then it says, well, who cares? It sort of feels like everything's COVID now went on the background, which is, I guess, a good thing. But the good news is that actually the numbers are dropping really quickly. Hospital is pretty empty. I think the whole hospital has like one patient, GW hospital. So some good news there. So yeah, and I actually was trying to look for some specific news, and I couldn't really find a whole lot of interesting updates outside of the few minor things, like, for example, that definitely there is a more clarity that the third booster continuously seemingly maintaining the efficacy, and the idea of fourth booster is now being pushed further and further. So if you don't have any particular significant immune compromise, I think it's probably safe to say you don't need a fourth booster at the moment. Unfortunately, it looks like that original idea of having Omicron specific boosters by the spring is not going to happen. Now I see the timeline shifted more towards the fall of this year. And I guess that really means that the virus is mutating faster than they can try to develop updated variants for the boosters. So we may end up, just like we predicted, with more of a flu-like situation, with vaccine being developed annually and always slightly behind, meaning that the efficacy is always going to be a little less than what we would like it to see. But I think that's yet to be determined. So yeah, and then I think one other update, we quite excited that Ashley, who's here. Ashley, I don't know if you want to wave at people. Maybe Janet can spotlight her. So Ashley, who is actually now on staff at the Office of Integrative Medicine, actually at the Wellness Office, who's also joining CIM clinically, and we hope that she'll take a leadership in integrative post-COVID work because it's very, very needed. So welcome, Ashley. And Ashley gave us, was it last week or week before? Now everything is in my head is a little, I apologize, is a little.
Yeah, it was a couple of weeks ago.
Yeah. So yeah, so put questions in the chat. If there is no questions, I'm sure we can give my time to our speakers, to Hana and Macy, and we can go from there. Yeah, Lisa keep asking about the Novavax. I have no updates on Novavax, mostly because, as you know, it's never going to be available in US. So I think there's very little interest for me to keep being updated since we can't really get it. So, all right. Well, I don't see any other questions. Quiet crowd today. That's exciting. How about this? If anybody have any questions come up, maybe we'll take a couple of minutes between Hana's and Macy's presentation and before we do our nature experience today. Well, thank you. Oh, is it okay? There's a question. Is it safe to go back to indoor gym with or without masks for seniors? That's a hard question. I think go back to gym with a mask. The problem is that you're going to see a lot of people now, especially since DC had cut out the mask mandate. you're going to see people in the gym without the mask, and the gym is one of those places where you have a higher exposure if somebody is sick. So theoretically, remember also the requirement of location to have the vaccine. So to document the vaccine means almost nothing, because it means good for the person who had the vaccine, but for you, that person could still be a carrier. In fact, it's unfortunately pretty clear that being a carrier, the vaccines have very little impact on. So I think just checking people's vaccination cards and checking fever is like a little bit of I don't know, the efficacy of that is very low. So you can definitely mask, or you should mask even if everybody else is not, but that's not necessarily going to be foolproof. So CJ, I'm sorry, I'm not giving you a good satisfactory answer, but I think that's the best. You have to make your own decision whether if there's some risk, is it justifiable? If you're fully vaccinated and you're thinking of taking that risk, is okay for you personally. Yeah. Okay, cover study on okay. Yeah. You want to say more about this? You want to unmute and say a couple of words, Ashley?
Yeah, so I listened to it. They did a webinar, and I think they're going to have regular webinars about their Recover study, which is their largest study on long COVID. And so they're right now just in the epidemiological stage of it, trying to figure out how many people have been affected, gender, race, all of that, and whether or not the vaccine is truly going to be preventative against long COVID and post-COVID sequelae. So it's pretty interesting to look at, and I think it's going to give us some great information. So something to keep track of.
Yeah, so Jennifer, that's a good question. So I think partially what we're going to do soon, once we sort of get going, we're going to establish some ongoing clinical protocols for post-COVID. Right now it's more of a, what Ashley said, is kind of mostly observational. So we're collecting a lot of data, there are labs that are collected. But in terms of actual interventions, there isn't any standard of care interventions. There's some basic support for symptoms that are evolving, but those have very limited effectiveness. So we're going to try to come up with the protocols that are a bit more whole person oriented. And yeah, stay tuned. I'm sure once we have something concrete, we'll present it. So, yeah. All right. I think with that, thank you very much. And off to you, ladies. Thank you so much for coming.
Thank you so much for having us. Let me just introduce ourselves. My name is Hana Kahleova. I'm an endocrinologist and I'm director of clinical research at the Physicians Committee for Responsible Medicine, which is a nonprofit organization that provides nutrition, education, and research. And Macy, my colleague, is a study coordinator. So we'll give you an update on what's going on, what may be beneficial for you. I'll tell you about one of our papers that has been published on plant-based diets for COVID-19. And Macy is going to tell you about a study for women with endometriosis using a plant-based diet. So let's dive into this, and let me share my screen. Plant-based diets and COVID-19. Is there any difference in what we eat and how we react to, to the risk of developing COVID-19? So we published a paper in the European Journal of Clinical Nutrition just a few weeks ago. So you can read the whole paper if you'd like. I can definitely send it to Janet and she can circulate it if you'd like. We know that lifestyle plays a major role in our risk of developing different chronic conditions, high blood pressure and high cholesterol and diabetes, and so on. What we already know from the vaccination trials is that even if you're vaccinated against COVID-19, the efficacy of the vaccine is affected by your lifestyle. So for example, people who are overweight have a lower titer of their antibodies after getting their shot against COVID-19. The same is true for smokers, and they just have lower levels of antibodies after the vaccine. People with a high blood pressure also have a lower titer of antibodies. And the same is true for people with high cholesterol. So what if we adopted a plant-based diet? What would happen then? We know that plant-based diets help reduce the risk of developing high blood pressure, high cholesterol, and diabetes. So what's the relationship between eating a plant-based diet and developing COVID-19? There's a few studies that have been published on this topic. The first one only looked at how much fruits and vegetables people were eating. And those who were eating the most fruits and vegetables had a 41% lower risk of developing severe COVID-19 compared to those who ate hardly any fruits and vegetables. By the way, we all know that the recommended dose of fruits and vegetables is about 5 servings a day. What do you think is the average in the United States? You can put it in the chat box. How many servings do the Americans eat of fruits and vegetables? Janet is saying 2 servings, and that's right. About 1 serving of fruits and 1 serving of vegetables, like not so great. So we can definitely do better on this one. Interestingly, eating fruits and vegetables was also beneficial for reducing the overall risk of getting the infection in the first place of any severity by 9% only, but it's a mild reduction. Then another study looked at 3,000 healthcare workers from 6 countries, including the US, and those who reported following a plant-based diet had a 73% lower risk of moderate to severe COVID-19 compared with the ones who reported omnivorous diets. When we look at the world, we know that the blue zones are the areas where people live the longest and are the healthiest on Earth. And one of them is in Okinawa, Japan. And people eat a lot of rice and vegetables, especially green leafy vegetables, a lot of soy products. About half of all the calories are coming from sweet potatoes, and the diet is super low in fat. So it's a predominantly plant-based diet. And I was curious, with such a healthy diet, when we know that in Okinawa, the number of people who live to at least 100 years old, the centenarians, the number is twice as high compared with the rest of Japan. And Japan is the leader in longevity in the world. So it's pretty impressive. So I was just curious, how are the COVID-19 outcomes in Okinawa? And so I looked at the charts for Tokyo and for Okinawa, which are the areas in Japan with about the same population. And I found out that the COVID mortality rates are 16 times lower in Okinawa compared with Tokyo. Of course, there's other factors in play. If you live in Tokyo, there's more air pollution, more of a sedentary lifestyle, and other factors. But it seems like the lifestyle in Okinawa, including the plant-based diet, can definitely have also a protective role. And it's one of the reasons why eating a lot of fruits and vegetables and eating a plant-based diet might be good for you, not only to reduce your risk of developing diabetes and high blood pressure, but also in a time like this when we still fight COVID-19. And with that, I'd like to hand it over to Macy to tell us how a plant-based diet might help with such a condition as endometriosis.
Hi, everyone. Thanks, Dr. Kahleova. My name is Macy. I am the clinical research coordinator for the upcoming endometriosis study. I'm going to share my screen also. I have a quick presentation. Okay, so we're doing a study on endometriosis, and I want to give a very brief intro to the condition. So endometriosis is a chronic and inflammatory disease that affects over 170 million people globally. Pain is the most common symptom, and it's often debilitating. It can lead to depression, anxiety, and missed work, and endometriosis is often associated with infertility. There are limited treatment options for endometriosis, and there is no cure as of yet. The treatment options now are mostly hormonal medications, pain medications, and surgery. And there's a relatively high risk of recurrence with surgery. So many people who have surgery one time will end up having it several more times. And finally, there is limited evidence on the role of nutrition in endometriosis treatment. The evidence right now is mostly anecdotal, and much of it is inconsistent, and nearly all of the researchers call for more randomized controlled trials. So that is where we come in. We're going to be conducting a randomized controlled trial of a nutritional intervention for endometriosis, wherein participants will be randomly assigned to one of two groups. One group will make no change to their diet, and the other group will follow a low-fat plant-based diet. Those in the plant-based diet group will participate in weekly nutrition classes with physicians, health coaches, and dietitians over Zoom. The three main outcomes that we're going to be looking at are pain, inflammation, and quality of life, which we'll be assessing through questionnaires and blood tests. And we are currently in the recruitment phase. We've been contacting primary care physicians, OBGYNs, infertility specialists, and other pelvic health specialists to tell them about the study and see if they have any patients who might be interested. We're also using social media such as Facebook, YouTube, Instagram, and Google to advertise directly to people in this demographic. And the study we're anticipating the study will start in April, and it will last for 12 weeks. So it will go until about early mid-July. A few of the essentials in terms of being included in the study or excluded would be age. So right now we're recruiting for females who are between 18 and 45 years of age. They cannot already be vegan or plant-based. They must have a verified diagnosis, either through surgery, imaging, or a clinical diagnosis. And they must live in or around the DC area. And that's because we're going to be taking blood samples that need to be stored a particular way. So that needs to be done locally for now. And lastly, I want to show you some of the recruitment materials. So here is the flyer that we have posted around some doctors' offices and in the community. The main piece of information to note here is the website for people to go to. And then we also have these little box cards. And again, the website here for pcrm.org/endometriosis. There's also this QR code, which can be scanned on the computer or on any of the paper forms, and that will bring you to this website also. This is my phone number, so people are welcome to reach out to me via phone. And my email is on the next slide. So part of why we're sharing this is because we would like your help with recruitment. We know that there are many, many people in the DC metropolitan area who have endometriosis and may be struggling with treatment or managing their symptoms, and we would like to reach out to them. So if you know of anyone with endometriosis who might be interested, or if you perhaps have endometriosis, or if you know of a doctor, or if you are a doctor who might help us recruit, please contact me at my email address, which is msutton@pcrm.org. And we thank you very much.
Thank you, Macy. And we'd like to take your questions. Victoria is asking if severe COVID is defined as being hospitalized, and that's correct. Yeah, severe COVID is when you get to the hospital. That's exactly right. Do you have any questions for Macy about the endometriosis study? I mean, just imagine being in those women's shoes, right? Like you're having this pain, and if someone can help you improve your nutrition and reduce your pain potentially, that would be just awesome. So please help us to target these women who need the help the most. There's also a question if it can include an adenomyosis. So that's a slightly different condition. So if the pain is due to other conditions, these women would not qualify for the study. The pain needs to be due to endometriosis. So it needs to be a verified diagnosis of endometriosis. But a great question, because we can experience pain for many different reasons, but this study is specifically for women with endometriosis. Does a plant-based diet mean no meat? That's correct. If not, how much, and if meat and fish? Yeah, so there's also flexitarians or semi-vegetarians who sometimes eat meat, and some of them eat only fish or only white meat, in contrast to eating any kind of meat. But being on a plant-based diet means really no meat whatsoever. And on a vegan diet, you exclude all the animal products. So you don't eat any meat, any cheese, any dairy, any eggs, and you only eat plants. You only eat grains and legumes and vegetables and fruits and some nuts and seeds. A great question. What was the email address? So Macy just sent you the email address.
And I'll include that in the email that I'll send out this afternoon.
Thank you.
Thank you so much, Janet.
Now, one thing I would suggest for anybody who's interested in participating in this study, or you want to share it with someone who you think could benefit from the study, please make sure to email Macy first so she can sort of do a preliminary talk with them to make sure that they meet the parameters for the study. I unfortunately was not able to take part in the, I think I tried, what was the previous study that you guys had a call out for a woman's health issue?
We just finished a study for postmenopausal women with hot flashes.
Yes.
That's another one, right? Like how many of
I'm
hot
not
flashes?
menopausal enough.
Yeah, exactly. So like if nutrition can help with all these issues, like why not give it a try for 12 weeks? And there's another question. How does the plant-based diet for the endometriosis study look like? Macy, would you like to jump in on this one? Does it include eggs and dairy?
So the plant-based diet for the intervention group will be just like Hana said. People will not be permitted to eat any sort of meat, fish, dairy, eggs, cheese, really anything that comes from an animal will be excluded. In addition to that, it's a low-fat diet. So we're asking people to keep things like oils and certain foods like avocados to a minimum.
Yeah, thank you, Macy. And Jennifer is asking about, farm, having the meat and dairy from a farm where everything is organic. Of course, that's much better than having, all these products that have been processed. But at the same time, you're still eating a lot of cholesterol and saturated fat, even in these healthier options. So switching to a completely plant-based diet, will give you some additional benefits. And you may give it a try for only, for fun, for a few weeks. We have a vegan Kickstart program that's only 3 weeks long. You can get the recipes. And if nothing else, you will just discover how you feel on a plant-based diet. You will learn some new recipes that you can be using for the rest of your life. And you don't have to follow it for the rest of your life, but it's just kind of fun to experience it on yourself and see, how your mood improves and how your sleep improves, how your skin feels. And, it's just fun to experience it on yourself.
Okay, on that note, thank you so much, Dr. Hana. Thank you so much, Macy. We really appreciate you all coming and speaking to us today.
Thank you for having us.
Thanks so much.
So now
I think we can go straight to Ilana. I'm going to answer Elizabeth's question in the chat because I think it's not really a true question. It's more of a point.
Okay.
All right. I didn't mean to cut you off, Jeanette.
No, that's okay. I was just going to say welcome.
Thank you. And thank you to all of you for having me as a part of your afternoon today. My name's Ilana Rubin, and my practice is called Kindred Nature. I'll just share a screen that has a little bit of information of how to contact me before we really get started. And let me know if folks cannot see this as the picture of dragonfly. So again, Ilana Rubin, I'm a nature therapy and forest bathing guide. And I know that many of you have experienced a taste of something like this with a couple of guides in previous sessions and earlier weeks. So I'm honored to be here with you all this week. And I want to share the part of what I believe in and what inspires me to be guiding this is the connection with nature that is wherever we are. So of course, there is nature outside in the wilderness or in our neighborhood parks or the trees that are planted on our street. But there's also bits of nature that I think probably each of you might find in the space where you are right now. Perhaps you have a view out a window, or maybe there's a plant near you, maybe a rock collection or a seashell, or even a glass of water, or perhaps even it's just the oxygen and the air that was breathed out from some trees. So there's also ourselves as humans, and just recalling that we are also part of nature in our way too. So with all of that said, I'm going to unshare my screen because I will be sharing that again at the very end. And I'm going to lead us through some prompts, and all of this is an invitation. So whatever I'm offering, it's up to you to engage in it in the way that feels comfortable and right for you. If I name, for example, a certain sense, like maybe smell or sight, and that's not one that you're able to or wanting to engage with, then please just engage in the way that does work well for you. And throughout all of this, I also welcome you to really listen to your body and to respond to that in whatever way feels comfortable. So if for you, if that means keeping your video on, if that means keeping your video off, sitting or laying down or standing up and moving around, stretching, whatever, you don't have to be still or in a certain position throughout all of this. If you need a drink of water or a snack, just tuning into what your body is asking for, if that's something that you can provide. So again, just sharing gratitude to you all as we begin now. First, I invite us to just notice this space where we are maybe looking around in different directions and really arriving in this moment. And then whenever you're ready, you might like to either close your eyes or perhaps lower and soften your gaze. And as you do, just notice what it's like to be breathing. Just normal breaths. And I wonder what it is like to be in your body in this moment and this place. Perhaps you'd like to tap into your imagination and imagine that with each beat of your heart, there are roots growing from you out into the space around you. Imagining that the tips of these roots have eyes, I wonder what they might encounter or who they might meet. Now, calling these roots back to your body and shifting our sense of focus to our sense of touch. How does the air feel on your skin? Perhaps there are textures around you that you would like to explore. Maybe textures that are on you. Maybe if there's a plant or some other object near you, seeing what that feels like against your skin. Or perhaps what your own skin feels like against your own skin. Next, shifting our attention to our sense of hearing. I wonder what sounds this place has to offer you, or perhaps if there is quiet. I wonder what is the farthest away sound that you can hear. And what might be the closest sound that you hear. Maybe you'd even like to explore mixing a sound of your own with the sounds around you, whether that's the sound of your breathing or any other sound. And noticing if sounds that you hear might be ones made by other humans, or perhaps by any other animals or beings, or something else. And taking a moment again to listen to our body and notice if there's anything that's giving you a bit of comfort or joy, to invite that to linger with you. Now shifting to our sense of smell, or perhaps the sensation of air moving through your nose if you prefer. I wonder what this place might have to offer you that you can notice with your nose. Maybe you'd like to explore sniffing like you're another animal, like a fox might, or a rabbit. And as our sense of smell is connected with our sense of taste, we'll move to that. Or you may also focus on the sensation of the air moving into your mouth as you breathe. You might like to try taking a sip of the air as if through a straw and seeing what that's like. or even sticking your tongue out and seeing what you notice. Now, tuning into our heart or feeling deep in our body, I wonder if you feel anything drawing you to turn in any different direction. If you like, go ahead and just turn. You can stop whenever your body says to stop. I wonder what might be calling you or drawing you in that direction. Is it something or someone nearby, or perhaps very far? Just noticing what it feels like in your body to be facing the way that you are facing. And once again, inviting in anything that gives you comfort or any feeling of goodness, inviting that to stay with you a little bit. And in a moment, but not just yet, we'll open our eyes or lift our gazes. And when we do, you might imagine that all that you are seeing for the first time. So whenever you're ready, slowly open your eyes or refocus your gaze. Just allow your eyes to wander wherever they like. I wonder how many different colors you might notice where you are. And if it feels comfortable to you, perhaps lifting your arms out to the side and wiggling your fingers a little bit and exploring the edges of your vision, seeing where's the edge of your peripheral vision and what is it like to see and notice movement at the edges of your field of vision. And also exploring what it feels like to explore that kind of movement. And exploring with any sense that you like, any motion or movement in this place where you are. Maybe you're noticing motion that's happening around you, or inside you. Maybe there's stillness or signs of motion from the past or motion that's yet to come. Just explore that for a moment. Now taking a few breaths, just regular breaths at your own pace. And let's come back together again. If it's comfortable for you, you're welcome to have your video on, or if you prefer, you can have your video off. And I'd like to invite us all to share, not just yet, but in a moment, to share what are you noticing. And in order to be able to welcome and sharing from everyone within the time that we have, I welcome you to share either in the chat with one or a few words, or with a gesture that you might like to show on video, or you could even make a gesture or a sound in the space where you are, and you don't even have to share it out loud with us all, whatever feels right for you. So I'm going to count down from 3, and then I will say share when it's time to share. So now if you would like to share what are you noticing in the chat, you can go ahead and take a moment to type that in the chat. If you want to share a gesture, to think of that, knowing that all is welcome. So now, thank you. People are beginning to share. So we'll say 3, 2, 1, share. We see peacefulness. That was beautiful. Thank you. I'm more acutely aware of all my senses. Serenity. I'm feeling more grounded, calm, and love, tranquility, and welcoming in whatever else you might be sharing in the space that you are in. Now I'm going to shift us towards beginning a conclusion of this experience. And part of that, slower heartbeat, I see. Thank you. I have prepared some tea here. And if you have anything around you that feels nourishing to you, welcome you to bring that closer to you, whether that's something to drink, something that you like to look at or touch, or a memory that you like to hold. And just take a moment to direct towards that any feeling or thought that you might want to share with nature, with all the different beings that you might feel any connection with. And perhaps exploring with your senses, or however you like, whatever that is that you're holding or connecting with. For me, I'm noticing with this tea It has a freshness in the smell of it. It has a little bit of a golden color. And this is a tea that I've made from a spruce tree, a Norway spruce tree that grows outside. And here's a sprig showing some of the needles of it. So I just brought this in earlier this afternoon and I steeped it in some hot water. And a tea like this can be a nice source of vitamin C. Some people have used it to help ward off things like scurvy or to help with decongestion or support respiratory health. But of course, you should consult with any of your healthcare providers before you're trying something new for medicinal use. So now I invite you, just if you have something to sip or to hold or look at, taking a last moment to do that. And when we take that sip or when we release that hold, that will be the conclusion of the forest bathing nature therapy experience. I'll still be here for a few more moments, but that will be concluding this experience. So whenever you're ready, just go ahead and either take that sip or hold and release. Has a nice sprucey, piney flavor to it that I love. Personally, I just enjoy this tea for the unique and bright flavor of it. So now I want to just share again my screen to share that information about me from the beginning. And thank you everyone again for participating in this experience. This is, again, my name is Ilana Rubin, the founder and nature therapy and forest bathing guide at Kindred Nature. And you can see there I have a little website, kindrednature.card with 2 R's.co, or you can email me at kindrednatureguide@gmail.com. And I do provide forest bathing and nature therapy experiences that are longer. They can be 2 hours or a little longer, a little shorter, or samples like this one. And I offer that and experiences in person to groups, to small groups, or a little bit larger, and also remotely guided in different ways like what we did today. That way people can participate from anywhere they have a phone or internet connection. For example, a couple of in-person things I'm doing soon. Tomorrow I have 2 private walks. One is celebrating a birthday for a couple of folks, and another is going to be part of a retreat. So I think we stopped sharing my screen, which is good. And if anyone wants to share anything else or any questions, please do. But I'll just say I have so much gratitude and warmth for you all sharing this bit of time. And I hope you all have the kind of weekend that you need.
Thank you, Ilana, so much. I hope we will have you back at some point in the future. Thank you, Macy and Hana. Good luck with recruitment. I don't do a lot of research, but I know how hard it is. So I'm really admiring your effort, and I hope you guys move with your timeline. So actually, I think the timing is not so bad, because I think as COVID goes lower and lower number-wise, it hopefully will be easier to get enough patients. And again, just to reiterate, if any of you are interested, or if you know somebody who have endometriosis, Macy, can you do me a favor? Can you put again once more the contact information at the bottom in case
Sure.
somebody is struggling to find it? And Janet will make sure we include that into the when we send and when we post the summary of today's video.
Thank you so much.
And yeah, and so everybody, apparently it's supposed to be an absolutely gorgeous day and the weekend, so it's a little chilly now, but it's going to warm up. Enjoy. It sounds like we're getting a spring, whether we want it or not. See you all. Well, you won't see me next Friday. I will not be. I'll be on my way to Israel to give a talk in Tel Aviv. But I'll see you guys the week after.
Bye, everyone.
Everyone.
Bon voyage.
See you. Bye.